Okay, we're going to go ahead and get the meeting started. I want to thank everybody for coming out this evening. You can't hear me?
You be louder.
Oh, you want me louder, huh?
There you go.
Try that one.
Well, no,
No,
never
go
mind. No comments about big mouths. Okay, I do want to thank everybody
No.
for coming out this evening. No?
I don't think it's true.
Can you hear this one? Really close to your mouth. Right there. Get there. There you go.
Okay.
There you go.
Now, I'm going to thank you for the third time for coming out this evening. We have a presentation for you of some of the highlights of this year for rescue, and we will open it up periodically throughout the presentation for any questions that may come up or comments that you might have. I would ask that you please raise your hands if you would like to speak so that we can direct the microphone to you so that it's recorded on the videotape of this meeting. So that being said, I'm going to turn this over to the chief.
Thank you. And again, thanks for coming out and for everybody. BC TV is here. They're going to be recording our meeting. So if you're speaking, look towards the camera so that they can know who you're speaking. And I would assume that it would be helpful if you said what your name is and kind of where you're from when you're speaking. That way, as you're taking the video, it will be helpful. So as we kind of move through the presentation, as Kathy said, I'm going to go ahead and ask for questions rather than getting to the end and then going back to the beginning. So certainly, if you've got a question, raise your hand, and I'll do the best I can to get you an answer. So we've been doing this now for quite a few years, where we get all the towns together. We take the opportunity to talk about what rescue has done, what rescue is planning on doing, what our challenges are, and kind of where we are as an organization. I think it helps everybody to understand, the direction of EMS in the region and the importance that we all play as part of a big EMS system. So what you may or may not know is that this is 55 years for rescue. So this organization started with a group of volunteers many years ago. We've had a couple of locations on Canal Street in Brattleboro. In 2005, rescue was in a position where Grace Cottage Ambulance was no longer able to provide service to the West River Valley, and we added in a second station. So right now we serve 15 towns with two locations. So as you kind of look at the map, that's a pretty big stretch of kind of the Route 30 corridor that we cover up into Jamaica. So where are we at right now? And this changes, but as of right now, we're serving 15 towns, 500 square miles. We're doing that with 10 ambulances. And people that have heard our presentations previously know, hey, that's more than you used to have. The reason for that is COVID. There's significant out of service time every time we go on a run with the disinfection of ambulances. So we were this year fortunate to have already ordered a replacement ambulance, and we kept the ambulance that was going to be replaced to make a 10 truck rotation, so that as we've been dealing with COVID, we've been able to decontaminate our trucks. Lots of staff vehicles, lots of tow vehicles. We still have technical rescue. We have 3 boats, a UTV, and new to this year, 3 COVID vaccination trailers. And we'll get into more how we're using those resources as we go on. At the bottom of the screen, over 6,000 calls. So early 2020, when the pandemic hit and the lockdown orders came in, we saw a drastic decrease in our call volume. Not only is that rebounded, but it's rebounded in a different way. It's rebounded with hospitals struggling to have bed capacity, and it's rebounded with longer, further trips to specialty centers that's taking our crews significant time. So the key to our organization is always the people that work here. We have 78 staff members. The staff are EMS professionals that work in both this station and our Townsend station. Our crews rotate back and forth between the two. Our staff also includes specialized rescue personnel, office staff, and training staff. The way we make this work is through a scheduling of staffed ambulances. So at any given time, there's always staffed ambulances in both our Townsend office and our Brattleboro office. When one area is busy, we rely heavily on the other area to backfill. We have a series of on-call personnel that backfill the area that is not busy, which is a strange concept to most. But if the Brattleboro area is busy, we backfill Townsend because the quickest available resource to us are staffed ambulances in Townsend. So as it gets busy down here, the Townsend ambulances come south and provide that additional coverage, and our backfill crews backfill Townsend. Likewise, if our Townsend office is busy, which lately it seems to be the case with multiple calls, the Brattleboro crews that are in the station here will backfill Townsend, and then our on-call personnel will backfill those ambulances, allowing us to have surge capacity up to all 10 of our ambulances. So the surge capacity is really important. On top of that, our crews are ready to respond to many other types of incident. So our specialty rescue crews, our technical rescue crews, respond to water rescue, high angle rescue, search and rescue, and pretty much anything else that can be thrown at them. So the people, I think it's important, and this is just a few of the 78 people, to point out that these are people in each one of your communities. When you look up here, and I'm sorry there's not every face of every person in our organization, but the slide was getting a little bit cluttered when we started putting everybody in. Our members live and work in your communities. We have membership from almost every fire department, every first response squad. We have members that work in law enforcement. We have members that work at our hospitals. We have members that work in our school system. People that work here at Rescue live and work in our communities. They volunteer as part of their local first response. They're really what stands up the emergency response system in this area. All good stuff. What does that mean for us when we have major incidents? What it means is many of our personnel are pulled in multiple directions. Being the fire chief in one area and an emergency medical responder in the same area. It can be challenging, and we've worked out ways to manage that. All right, it's gonna go slow. So I think it's important that you understand that rescue is involved in EMS leadership. And every aspect of what's happening in EMS in the state of Vermont, we're part of. The EMS Advisory Committee, which is setting the goals, the objectives for EMS growth in the state of Vermont, is where we're most active. We have personnel on the EMS Protocol Review, EMS District Board, the newly formed Wellness Commission, which is looking at mental health and first responders. We have a seat on that. We sit on the Search and Rescue Oversight Committee, Vermont Ambulance Association, National Ambulance Association Rural Task Force, looking at issues on a federal level that are affecting rural areas and rural EMS, as well as the Vermont Fire and Rescue Coalition. So if there's an area of leadership and guidance in EMS, somebody in this organization is participating. So in 2021, we've done some stuff. Everybody here has felt the challenges associated with pandemic life, with Zoom meetings, with school closures and other things, but we've managed to accomplish a few things. And it's really important to note that, we provide advanced airway management technology on our trucks. We're able to purchase new cardiac monitors, and we're starting the second phase of our point of care ultrasound project as part of our 911 medical response. And at this point, if I did not mention that in calendar year, fiscal year, or any other way you want to measure the year, 2021, we have not missed a single 911 call. There's not been a single request for mutual aid to provide coverage to any of your towns. And it's been that way for the last, how many years, Eric? Last 4 years. That's something that man stresses about every single day, making sure that your patients get the call covered that they need covered. Hospital transports. So I show you a picture, but you don't recognize the hospital. Anybody know where that one is? Concord, New Hampshire. UVM Medical Center. Boston. As our hospitals are struggling with staffing, bed capacity, and services, that's bleeding over into EMS. In the last week, we've been to the last month, we've been to Western New York, Southwestern Connecticut, Albany, Boston. If you can find a hospital, we've been there. And the reason for that is because none of our hospitals locally have the capacity to handle the patients that we currently have. This is not a COVID surge. This is a healthcare crisis. That's spilling over into EMS and certainly causing a lot of work, a lot of sleepless nights, and a lot of overtime on our staff. But we're getting it done. Technical rescue guys, throughout the entire pandemic, continue to train, continue to respond, doing search and rescue all over the state, spending days looking for missing people in the wilderness. We brought in new rope systems during the pandemic, trained and implemented updated protocols on how to do high-angle rescue with the most modern equipment and standards that are available with twin tension lines and auto-locking delay devices. Our Swiftwater team has been active, responding to multiple emergency management requests around the state for flooding and flood response. We're also heading up a new initiative as part of Vermont's USAR team, doing evaluations on Swiftwater teams around the state to make sure that the quality of response statewide is where it needs to be, and that we set an appropriate training schedule moving forward. Education's been tough. So in the last year, we have not been able to do as much community outreach and education as we normally do. When we had to shut down our training center due to social distancing, when we changed the rules about how CPR classes and stop the bleed classes would be taught, it hurt our outreach programs. Just as we were starting to think that we could do aggressive outreach and community education programs, we're now kind of pumping the brakes a little bit, waiting for this wave of the virus to slow down. Youth programs. Through the whole pandemic, we've managed to continue to support our youth programs. We now have 20 youth involved in our program. It's based out of our Townsend office. We've been able to support them going to camp, learning leadership skills, including national youth leadership training. And I'll pause here for any questions so far.
Yeah, Chief. I'm Mike Frank from Chesterfield. You talked about 6,000 calls over the year. You also brought up the fact that you're transporting a lot inter-hospital. Can you tell me the ratio between first response EMS 911 calls to the scene and transport to the hospital, and as opposed to inter-hospital transfers? And also speak to the amount of time that those inter-hospital transfers take that car out of service.
Good question. So the answer is about 2/3 and 1/3. So 2/3 of our responses will be 911 emergency, what you consider to be a typical emergency response. And the other third of those responses would be hospital to hospital. So as part of our commitment to our patients, getting them through to definitive care is important. Many of our patients are suffering from illnesses or injuries that cannot be treated locally at one of our hospitals. So the patients that are brought in are stabilized locally, and then they need to go to an additional higher level of care for kind of that definitive care, the cardiac cath, the trauma surgery, or many other things, dialysis, that we can't provide here. We're going to show you a picture of a typical day in a couple slides, and I'll address the second half of your question then, if that's okay. Other questions? All right, so I realize that most people don't think about what happens when we call 911. How does this actually work? You dial 911 and stuff happens. Well, what is that? Well, the first thing is you're gonna have a 911 operator. That 911 operator is gonna take your call. They're gonna ask you what type of emergency you have. They're gonna take some information as to what the issue is and your location. In this area, they're then gonna turn that call over to a dispatcher. So the 911 call taker does not dispatch ambulances. That 911 call is either gonna go over to Keene Mutual Aid for dispatching outside of the town of Brattleboro, or in the town of Brattleboro, it's gonna go to Brattleboro Dispatch Center. They're gonna take additional information. That information about what the illness is, where your location is, and then they're going to dispatch an ambulance. They do that through a priority dispatching system where they look at the acuity of the patient based on a set of protocols. How sick or how injured is the person? Do we believe this is an immediate response or a justification to use lights and sirens or not? Many people don't realize that for the last 20 or 30 years, rescue has not responded with lights and sirens to many of our calls. In our system, we call those priority 2 calls. So calls that do not have an immediate life threat. The ambulances drive with the flow of traffic. Many in the public would say, well, why don't you go lights and sirens to everything? And the answer is the risk to the public, the risk to the crews, and the risk to the patients. This is the dispatch section of this call. They're right on cue.
Perfect.
We'll give them just a second.
Possibly pregnant.
Okay. I did not ask them to do that. That actually is a real call. But yes, so that's how our dispatching system works. So this call, as it just came out, was a priority 2 call, so they will not be responding with their lights and their sirens. They'll be going with the flow of traffic. So one of the measures that we get asked regularly is, what is your response time? And what I tell people is, it actually doesn't matter. That's a measure that we no longer use for the success of EMS. In fact, in some areas of the country, and certainly some areas around the world, many of these calls are triaged into categories where the response is significantly delayed, and in fact, the response is no longer by an ambulance. Because quite often the care that we need to provide these folks is not emergency rooms, it's follow-up, it's counseling, it's more wraparound services. So as we work forward into the future, we're going to be looking at these dispatch algorithms, and more of the calls based on science are going to be turned into this priority 2 status, where to reduce the risk to everybody, the patient, the providers, and the public, we don't respond with lights and sirens. So the next phase of our response is determining what is the appropriate crew. In EMS, we have 3 primary license levels. We have EMT basics, we have advanced EMTs, and we have paramedics. Believe it or not all calls require a paramedic. In fact, less than 10% of the calls in our system require paramedic level care. So in the building, those calls are triaged again, and we determine which crew is the most appropriate to take the call. Is it an EMT basic crew, an advanced EMT crew, or a paramedic crew? Dispatchers continue on the phone to gather more information. You stay on the phone with them, they ask more questions, they clarify what we're going to be encountering when we arrive. They fill in the crews, and sometimes we make adjustments in those decisions where what was a priority 2 becomes a priority 1, or what was an AEMT call becomes a paramedic call. In all areas that we cover, we have first response. First response is dispatched either just before or at the same time as the ambulance crew. Quite often, the first responders are closer. Quite often, they arrive either at the same time or several minutes before the ambulance. Their objective is to provide life-sustaining care, bleeding control, airway management, CPR, as part of a joint response in an EMS system. When the ambulance arrives, there's a discussion, there's a patient handoff where the first response crew explains what they've done for an assessment, what procedures, what interventions they've done, and they turn that patient over to the ambulance crew for a care plan. What is next? Are they going to the hospital? Are they not? Do they need interventions, medications, procedures, or not? The transport seems like the easy part. But we just put them in the ambulance, we decide how we're going to be transporting. Is it a life-threatening emergency? With lights, without lights? What is the most appropriate hospital to take them to? We get to the hospital and we turn over that patient again, making sure that we provide all the information from the scene. Information that will be lost if we didn't share it. What was the condition of the scene on arrival? Not only are we looking at the patient, but we're looking at the accident scene. Not only are we looking at the patient, but we're looking at their living conditions. Key information in the long-term treatment of the patient. So we relay all of that information to the emergency room staff, along with whatever interventions the patient received, medications, procedures. At that point, we're about halfway through our patient encounter. The end of our patient is not when we drop off at the hospital. In fact, we're about at the 50% mark. We now need to clean, disinfect, and document what happened on the call. In the world we live in now, each time the ambulance comes back, we're using a combination of ultraviolet light and ozone to sterilize the ambulances in order to protect the next patient, in order to protect the crew that has to work out of that truck. That process takes an hour in order to clean, wipe down, and disinfect the truck. When they're done with that, there's the documentation of the call, a process that can take 45 minutes to an hour on its own. So as we look at what is in a call and what makes up an emergency call, we can't forget the cleaning and the documentation. And I'm sorry if you can't see the slide, there's a lot of stuff going on. This is a day here at Rescue. And this is not a day where we had anything abnormal happen. This is not a day where we had a bus accident. This is just a day at Rescue. Our crews are on 24 hours a day, 7 days a week. They start their shifts at 8 o'clock in the morning. They end their shifts at 8 o'clock the following morning. Those little bars are different units going out and responding to calls and how much time they're tied up on those calls. What percentage of their day they're out of the building. What's not included in these numbers, because these numbers are the dispatch numbers. And when we sign off at the hospital, the dispatch number ends. So when we go from the building here to the scene, from the scene to the hospital, the dispatcher stops tracking us when we get to the hospital. So what's not in these numbers is the patient turnover, the decontamination of the ambulance, and the documentation. So you can imagine adding another block to the end of each one of those bars. On this day, it took us 6 ambulances to get the job done. On other days, it can take us 7, 8, 9, and sometimes all 10 ambulances to get the job done. All right, there it is, Eric. It's there again. We pride ourselves in responding to our emergency calls 100% of the time, all the time. 15 towns, 1 EMS system. I put in a few things up here that are just recent. I had to mention Lou. He's up here in our flood response. Anybody that was up in the West River Valley knows a couple weeks ago we had a major storm that came through. Tore up. It does that all night long. Tore up our roads, flooded some houses. Can we kill that too, Joe? Turn it down for me. Thanks. So that night, the response was people trapped in houses. That night, it was rapidly rising floodwater on top of the emergency calls. And I put Lou's picture up here because I want to call him out and point out to everybody here that he's consistently still responding. And here he is again at 40 years of service. So I just want to pause and thank him for 40 years of continuous service to this community and still responding in the middle of the night to flood rescue calls. If you don't see him, he's on this rock over here doing the body recovery as well. All right, it's going to be one of those nights. So I think it's important to know that we don't do just the 911 medical calls. We're called for lots of stuff. Vernon, KJ, one of our folks, full ballistic gear, standing by for hours for law enforcement standoff. Lou, 3 days searching for a missing Alzheimer's patient in Ludlow. An entire morning with a Swiftwater team searching for a missing person in Westminster. And little things that you don't think about. A hurricane that was projected to be as bad as Irene hitting this region. 28 people were in this building, staffing every ambulance in all 3 of our boats, standing by, ready to respond to the hurricane. Things we don't think about until they're important. In the middle of the pandemic, we were able to bring back Pediatric's car seat safety to rescue. Years ago, that moved to the Auto Mall as part of the Safe Kids Coalition. They stopped doing that, and we feel that it's very important to do the car seat checks and make sure that our children are safe. So now we're offering free car seat inspection and car seat check here every week. We also work to become a pediatric safe ambulance service. And as you walk by, you'll see the stickers on all the ambulances indicating that we have the training and the equipment to properly and safely transport pediatrics. Tough year at EMS, but another year of Gold Plus cardiac care, the highest level of cardiac care an EMS service can provide. Mission Lifeline looks at the EMS services response to cardiac incidents and strokes. What we're looking at is the care provided to those patients? And was that care appropriate and timely? And was that care transmitted and turned over to the hospital appropriately? This information comes from the outcomes, comes from the hospitals, comes from the patients, and that's how they determine the Mission Lifeline awards. All right, so a little bug rolling around, causing everybody a lot of trouble. Early in the pandemic, we, like everybody else, were trying to get ready for transporting patients. We were getting ready for disinfecting ambulances. We were getting ready for what happens if our staff gets sick. We were getting ready for all of the same things every other business was looking at. As we started getting into the fall of last year, the health department said, hey, we've got a problem. How are we going to vaccinate the 600,000 Vermonters in a reasonable amount of time? They reached out to us and said, we have a whole bunch of people that are homebound, and we need vaccines to the homebound. We said, sure, we can take care of the homebound population in the areas that we cover. We'd be glad to go to our seniors in our 15 towns and give them their vaccines. The next day, I got a call, and they said, hey, can you guys help us out with the seniors in Windsor County? And I said, well, I guess we can. Is there nobody else in Windsor County? Like, we don't have anybody in Windsor County. I said, okay. They sent us some vaccine. The next day, we assembled a team. That team included people from rescue, people from Londonderry Ambulance, local firefighters that joined our coalition, and we hit the roads with cars, and we went door to door. We vaccinated everybody that was eligible in the age bracket at the time that was homebound. I called back the health department. I said, good news. We got them all. And they said, great. How about Bennington County? And that conversation went, but we don't even know where the homebound population in Bennington County is. And they said, but the governor said we'd be vaccinating them tomorrow. So we sent our folks over to Bennington County. They were sitting at the Tractor Supply parking lot at 8 o'clock in the morning. And Deb, who's up here at our call center, was calling patients at their home saying, you've been identified as a person that is eligible for a home vaccine. Would you like one? Yes. When will they be here? They're outside your house right now. And we vaccinated all the homebound population in Bennington County. We did such a good job that the next day they told us to go to Orange County. The story went on, and when they told me that we were going to be heading up to above Burlington, I went, like Orange County is as far as we can drive. So we did a lot of home vaccines, 4,000 plus. We went to their homes, we vaccinated them in nursing homes. We're very proud of that effort. As the pandemic continued to go, and you remember we had a prison outbreak, they called up and said, hey, you guys were really good at the home vaccines. What do you think about going to Newport and vaccinating the prison guards? I'm like, yeah, I've never been to Newport.
I've never been to prison. Never
been to prison. So the good news is they didn't make us go to prison. We parked outside of prison. We vaccinated the prison guards. And that started this thing. And 150 clinics later, we vaccinated thousands of Vermonters from every single corner. We've been from Bennington to Brattleboro, literally to Newport and Burlington. We've met a lot of good people. We've partnered with a lot of agencies to support the vaccination effort. But that wasn't really enough, because we have a homeless population in this area. Our homeless population lives in our shelter where they have close contact. And as they became sick and tested positive for COVID, it became pretty clear that we needed to isolate them. We needed to move them to a place where they could have their social distancing and they could be evaluated and retested. And that place is Burlington, believe it or not. So every person in our homeless community that tested positive, we loaded in our van and we drove to a motel in Burlington so they could be observed by the health department. So that was our early spring. And they said, hey, those prison guards, that went pretty well. How about taking care of all of our educators? And you guys see where this is going. So we took care of all our teachers. And now, with the most recent outbreak, we're taking on surge testing. We've been traveling around our area to the local motels where our homeless are being put up, and we're testing that population in hopes to slow the spread of COVID. I put this picture up because I think it's really important for people to realize that this is not an effort that we took on by ourselves. This is an effort that we took on with many, many stakeholders. This is an effort that we took on with the Vermont National Guard, supporting them supporting us. We have Bellows Falls Fire, Leon and Gray. At one point we ran out of trucks and Windham County Sheriff came and pulled our vaccine trailer in so that we could continue to vaccinate. Londonderry Ambulance provided half the staffing most days. Cavendish Fire, West Dover Fire, Manchester, Vermont Fire Department. The list goes on and on. I couldn't put up enough slides to tell you how many different departments worked, supported, opened their stations, opened their community centers in order to let us set up and vaccinate people. So while that was going on, we had an operation to run, and we still had other things that needed to happen. So collaboration was all we could do. As you can imagine, running 911 calls, transports to very far destinations, clinics all over the state, searches, water rescues, we were pretty busy. The only way this worked is because we've got really good partners out there. We've got people that work very hard at what they do, that help us and we help them. Regional Ambulance up in Rutland. Last fall, we got together with Regional and said, hey, we've got an EMS workforce problem. COVID shut down all the EMS classes. There is no education program to bring new people into the EMS workforce. How about we get together and we come up with a hybrid education program? That hybrid education program turned into a single online didactic training component and 3 satellite practical sessions, including one here at Brattleboro that's brought another 10 people into the EMS workforce. Londonderry Ambulance, not only do they give us space, but every single day that we're out, they're sending us personnel to help support our vaccination and testing efforts. The health department, I talk to the health department 2, 3, 4 times every single day. We work very closely with the health department. They've certainly been a huge part of what we've been doing. The little picture you can't see here, Colchester Technical Rescue, helping us, working with us, training on swiftwater operations and boat operations. Their crew came down and spent a week with us with some out-of-state instructors helping us to kind of better build our collaborative water rescue resource in the state of Vermont. This picture here just represents and reminds me that we didn't stop training with our local fire departments. We did ice rescue training with Hinsdale, CPR and first aid training, stop the bleed training with other departments. Vermont State Police, it seems like every week or so I get a call from the state police looking for assistance with missing people, standbys, and certainly they're a valuable asset to what we do. Then Vermont National Guard. I never thought I would get this phone call. Hey, we got a clinic. It's being held at the Tunbridge Fair, and the Vermont National Guard needs you guys to come support them. Like, the National Guard needs us to come support them? Yeah, they needed us up there helping them set up their clinic site. So we certainly appreciate the work they did. Vermont USAR's team, Task Force 1, we're working with them on many projects, including continuing training on swiftwater and disaster response. And down here in the corner, our visiting nurses. And I couldn't get a bad logo, but our visiting nurses are amazing, amazing people. I had no idea until we started our home vaccination program that there was a person receiving visiting nurse services on the top of every single mountain in southern Vermont. Not only is there one, but those houses and those people have been there so long, they own the top of the mountain, and their neighbor, who's on the other side of the mountain, is also a senior. But you can't get between the two. You must go down and around the mountain and up the other side. These people are amazing. I can't say enough about visiting nurses and how much they helped and how much they worked with us to give us the context, the people that needed to be vaccinated, going into their homes and making sure they knew that some strange EMS guy was going to show up and try to give them their shots. There is certainly a huge play in the vaccination program. So the good news is that we're doing all right. We're tired. We're all well vaccinated. We're getting our calls covered, and we're doing okay. Our fleet, our staffing model are meeting the needs of our community. At least we think so, and I certainly want to hear what you say in a minute. Continued support of the 15 towns will continue to support us in all the work that we're currently doing. So I'm going to pause here before we get to the best part of the night, which is money. And I know everybody came because they want to talk about dollars. So do you have questions about what it is that we're doing here at Rescue? Do you feel like there's something that we need to be doing that we're not doing? Other than getting air conditioning in this bay. All right, that's a quiet room.
Yeah.
All right, they just want to get to the next one.
Yeah.
All right, here you go. So this is the new calculation for the town subsidy rates. I'm not exactly sure what that'll yield you, but if you work your town through that formula, you'll come up with something. In all seriousness, the census came to town, and they counted everybody, and they've made some adjustments to the way that things are happening. Up here, if you don't know what your census numbers are, here they are. Here's your 2010s, here's your 2020s. Some of you went up, some of you went down. So let me take you to the next slide. What have we been doing here at Rescue? Well, I can tell you that we've been keeping our rates pretty well under control. We've been keeping our requests to the town, I believe, very reasonable. We've asked for 1% increases for the last 10, 12 years, which I believe to be far less than probably what most of your municipal budgets are going up. It's far less than what our expenses are going up. We've been successful at coming up with ways to fill in those gaps so that we don't have to come back to the communities and ask for more money. We've worked very hard at making sure that the organization is financially stable and that our model is not only supplying what the community needs, but is doing it in a sustainable way. All right, so here's the elephant in the room. Drum roll, you want to hear what the rates are? Here's the new formula. What we're suggesting is that we don't change our rates at all. How many select board chairs in the room like a 0% increase in the first year, huh? That's pretty good, right? All right, and here's the reason for that. You guys are going to see differences in your rates this year. Some areas, those percentage increases are going to be higher because of the census change. And after a very lengthy discussion with our board, it was determined that we were just going to let this first year at 0% because you guys are going to kind of figure that out. Here's our formula. If you're out of our Townsend office, it's $29.50 times the new number from the census. If you're in the Brattleboro area, it's $24.02 times the population that the census says you have. Unless you're Halifax, in which case talk to me after because we only cover like 5 houses there.
Now, I do have the actual rates, the differences for all of the towns. If anybody wants to come up and take a look at the chart, you're welcome to after the meeting is over.
So then, we're going to ask you for 1% in the next year and 1% in the third year. Again, I think that is a reasonable request moving forward. So I was having a conversation with somebody earlier, and they're like, why 3 years? It's important to us as an organization to be able to plan on our revenue so that we can plan on our programs. No different than as you guys are looking at your tax rates and your revenue, being able to make decisions on more than a 12-month calendar is really important. So the intention is that we're going to ask each town to sign another 3-year agreement, understanding that we're able to keep these rates and keep our services the same because we're all in this together for the next 3 years. Changes in our system will change some costs. All right. Apparently I didn't get the picture to pop up. Nationwide EMS has a problem. You got a workforce shortage. If you've turned on the news, if you pick up your phone or your favorite computer or your browser and you type in EMS Workforce, you're going to find out that the EMS workforce around the country is terrible. Many services are closing because they don't have enough people. Many areas are delaying, not responding, mutual aid, and then you don't have to go far from here to find it. Literally across the river into New Hampshire, and they're seeing rates of missed calls that sometimes are in the 30+% range. Unfortunately, there's not a lot of people joining EMS. In Vermont, we have a paramedic program. Paramedic program generally graduates between 6 and 8 people a year. 6 and 8 people a year will not continue to sustain the paramedic needs of the state of Vermont. We also have no funding for education in Vermont. EMS providers in Vermont are required to pay the bill themselves. Seems kind of crazy. Do we ask our cops to go to school and pay for their own academy? Do we ask our firefighters to go to school and pay for their own? It's all state funded, town funded. EMS is not that way. Part of our workforce challenges, part of what our EMS advisory committee is working on. So what does that mean here? Well, we are very fortunate here. We've got some amazing people. We've got a handful of people that will be graduating from paramedic school this year. We've had the pleasure of hiring on some folks from out of state with significant experience that are going to be able to kind of keep us moving, keep us on the cutting edge of EMS for a long time. So when you see those news reports about national workforce shortage, it's there, it's real. In fact, it's a bidding war. When you look at what is happening in EMS, people trying to hire, people trying to just get their shifts covered, is pretty challenging. All right, so let's talk about some changes that may affect our system. You guys are gonna like, all right, you told us this 2 years ago. All right, so nationally, cost data reporting. Last 2 years, I've told you guys about cost data reporting. It's like, can you stop telling me about cost data reporting? Here's the thing that changed with COVID. Turned off my mic. Turned off my mic, there you go. Cost data reporting. They pushed back the cost data report due to COVID. So some people will say, well, it's great. You don't have to do all the work. You don't have to do all the paperwork. We have a chart of accounts of 567 lines. It's all broken out, ready to do the reporting. It's not that we don't want to do the work. We do want to do the work because we all know that Medicaid and Medicare pays less than the cost of delivering service. And if we can't produce those reports, if we can't do the cost data reporting, the cost data analysis on a federal level, we will never see increases in the rates that we're paid through Medicaid and Medicare. And we will continue to see shifting of those costs onto municipal tax dollars. So for me, it's a real bummer that COVID pushed back cost data reporting. Unfortunately, it pushed cost data reporting back 2 years, which means that the next report, the next GAO report on the cost of ambulance service is going to happen before the first piece of data is submitted. That means we're looking at no changes in our rate structure for probably a decade. Unfortunate, bad for the industry, certainly bad for everybody moving forward, but it's something we're going to have to deal with. In Vermont, in the midst of the pandemic, we passed some pretty cool legislation. I got to give it to our Windham County delegation. When we called them up and said, hey, EMS has got some problems, We have challenges that we had before the pandemic, and we got challenges that we have because of the pandemic. Can you guys help us out? They got on Zoom with me. We worked through the problems. We gave them the data, and they turned it into action. They turned it into legislation that's actually made a difference. In Vermont, we've changed the way that we provide training and education for our instructor coordinators, increasing the quality and the access to instructors. This all goes into effect on the 1st of January with a rule change. We created a new Vermont Responder. This one here is exciting to me because this is a creation of mine. I was working with the chief out of Sanford, Vermont, as he was telling me about how he's got one EMT in his town, but he's got 9 firemen. And the 9 firemen want to go to the medical calls, but they can't go to the medical calls because they don't have an EMS license. And they don't have time to go to EMT school and keep up with the continuing education. So after a long conversation, we decided we'd go to Montpelier. So we drove to Montpelier together, and he spent 2 hours telling me about this problem. And we came up with a solution. We said, why don't we create a new responder level that will let your people, with the training they have, become medical responders. We'll get those people on the ground, the people that are closest to the medical emergency that can stop the bleed, start CPR, open an airway, administer Narcan. We want those people to be close. If you're bleeding to death, you don't need a brain surgeon. You need a tourniquet. And very quickly we realized that we have a lot of people in our communities that are able to help. We're just not letting them. So we created and we wrote this piece of legislation, creating the Vermont Responder. It's going into effect on the 1st of January. It's going to be about a 20 to 24-hour training program. So if you've got first response squads in your town that are struggling, looking for personnel, ask them, have you heard about the Vermont Responder program? It's a way that we can get first responders on the road, saving lives. Very excited about that. I already mentioned the lack of training funds, but there's also a lack of ongoing training funds. Vermont doesn't have continuing education. We found out this year, unfortunately, that even the online education platforms that we've historically used in EMS are unfunded. We're working right now at trying to come up with some additional COVID funds, hopefully, to cover some of those statewide issues. All right, locally, I have to put it out there. Our local law enforcement situation is causing an EMS problem. I mentioned it last year. Well, now it's real. It's here. We do not have access to law enforcement that we need in order to protect our personnel. We are quite often receiving notices when the calls come in as possible domestic, violent person, suicidal, and we're being told law enforcement is not available. Law enforcement is not responding. Law enforcement is delayed by an hour or more. It's a huge problem. So what you're going to see is something different from EMS. Our medical director, our district medical director, is in the process and will be rolling out an official policy where during those times, the ambulance isn't going to respond either. Our personnel are not trained, are not qualified in dealing with violent situations. And putting EMS personnel into those positions is bad patient care, it's bad policy, and it's just overall wrong. It is not our role to deal with domestics, violent patients, and uncooperative subjects. On the other side of the river, I mentioned there's some challenges going on over there. Lots of missed calls, lots of retones, lots of mutual aid. In some areas, they tone 2 or 3 ambulances at the same time in hopes that somebody responds to the call. What's that look like in Cheshire County? That looks like more than likely a new municipal countywide ambulance service that's going to look a lot like the one you have on this side of the river. I've spoken to the folks over there and given them some pointers on how to run a system that's going to encompass 15 towns, 500 square miles, and manage about 6,000 calls. Like, hey, I know something that's really similar to that. Let me know if you need some help. I got some ideas as to how you can make that work. Then my very next question was, what about Hinsdale and Chesterfield? Because they're part of our 15 towns. And if they change what they're doing, is that going to affect everybody else in our cooperative over here? And they said, no, we want nothing to do with Hinsdale and Chesterfield. What they've got is working. What you guys have is working, and we're not changing. That's what I was told. So hopefully that's not going to be an issue for us. But I put it up there so that everybody knows that that is out there, and it's something that we're going to keep an eye on, and I'll certainly talk about it next year. Brattleboro Fire Department has put in for a license increase from the advanced EMT level to the paramedic level. That change may have an effect on the way that operations happen here in Brattleboro out of this office. It may have an effect on response times and on-scene times. And it's important that we put that out so that you know that there could be an effect associated with that. All right, so we're at the end of what I have to put out. And now I will gladly take questions, comments, concerns.
Peterrood, Administrator Gilbert. Did you get the microphone?
Yep.
Turn it on this time.
Hello. That one seems to work.
My name is Peterrood. I'm a town administrator for the town of Guilford. I was just wondering, going back to the topic of the service contracts, when rescue thinks you'll be able to get those out to the member towns, just because many of us within the next month or two are going to start budgeting for the upcoming year, and my select board needs to make a decision on that before we present it to our residents.
So I believe the board will take up the final vote on that at our next meeting. We always wait until after this meeting in case something comes up in this meeting that may have an effect on that. So I would expect you'll have that shortly after the next board meeting.
Thank you.
Mm-hmm.
Anybody else? What a quiet group tonight.
That's it. Not a.
So I do also have
Yep.
the
We
increases.
got a question in the back.
Gordon Little, also the town of Guilford. I'm the member rep for Guilford. Drew, first I want to say to you, I think you and your group, your employees here at Wet Rescue have done just an amazing job through this last year. I can remember sitting in our meeting when, COVID hit the fan and we started planning, we didn't know whether these doors would even be open. Never mind be here today to have this conversation, particularly with the budget that they're proposing with the town increase of, a slight percent here. So hats off to you and the group here. I guess my next question or some concern would be, Brattleboro has taken this step to at least look into having a paramedic. What could that potentially mean for the other towns if down the road something was to surface there where they wouldn't need you or us as much?
So still on. So the challenge with kind of looking at that, what is the effect, really has a lot to do with how the process rolls forward. So the challenges become how much additional resource is required to respond to that call. So in the kind of the world of EMS, turning a patient over to a lower license level becomes problematic sometimes. So as a paramedic, if an ambulance arrives after I've started treating a patient and that ambulance does not have a paramedic on it, then I end up on the ambulance and responding and going to the hospital. So in our current environment, all of our services, the highest license level is advanced EMT. And with the exception of maybe 2 or 3 times a year during surge capacity, we don't put ambulances out that are at the basic level. Our ambulances are going out the door as an AEMT level. So that problem doesn't come up. So that may be a challenge where a paramedic is being forced to be sent to a call or a paramedic is not necessary, simply to have a handoff, which will make that paramedic not available for whatever else could be out there. Kind of back to that previous slide of making sure that we send the right resource to the right patient, if that answers your.
Go ahead.
Following up on Gordon's question, based off of something you were saying earlier, Drew, given the fact that EMS staff are in such short supply, both here in Vermont and around the country, what's the likelihood that Brattleboro will be able to do that with that shortage of staff?
I really do.
Yeah, I can't and wouldn't dare speculate as to what they, unless Brattleboro wants to make a comment, but I wouldn't speculate on that. Do you want to?
Thank you. I'm Peter Elwell. I'm the town manager here in Brattleboro. Liz McLaughlin, who's the select board chair, is here tonight as well. What we're looking into is the possibility of, because we have one paramedic certified firefighter today, and we have other firefighters who are interested in getting trained to the paramedic level, is the possibility that we might get the additional, have the license upgrade that would allow the paramedics on the Brattleboro Fire Department to provide paramedic level services. So they would use the skills that they've achieved with that additional training for the benefit of patients in Brattleboro and calls that the Brattleboro Fire Department is responding to. It does come with complications. We're aware of that and have had communication with Rescue's leadership about how to make sure that there are protocols in place that, you know, our interest is to be able to not have firefighters who have paramedic level skills having those skills be unused when they could be used to the benefit of a patient in Brattleboro. But in making the change that we'd like to make, we're keen to the idea that it needs to be done in a way that doesn't harm the system. The system is working. And so there's protocols that we need to work out between the two agencies to make sure that it's very clearly understood what will Brattleboro firefighters do, what will rescue personnel do, how will we work together in those kinds of situations.
Lou? Yeah, the mic's over here. He's usually loud enough you can hear him.
Just 2 quick questions to that. One is, what is the average response time that Rescue will show up at, Rescue Inc. will show up at a scene that Brat Fire has already had? And the other piece is, having been involved in EMS, I'm wondering about what the legal implications are of one service taking on and starting patient care and then turning at a paramedic level over to another service, and something went wrong somewhere along the line. How does that work out? Who, you know, where does the buck stop in that?
So I didn't put the disclaimer up. I am not a lawyer. So I should have put that up as a slide. The first question, to answer the first question, is not long, within a minute or two. The town of Brattleboro is not very big. And as you saw earlier in the slides, for the most part, our ambulances are out the door immediately at the time of the tone. So there's very little difference in this town. Some of the towns where we have longer response times, Putney, the outskirts of Jamaica or Wardsboro. But as far as in town, it's for the most part pretty quick. From a legal perspective, that is a concern I do have, but I'm certainly not an expert in law and can't tell you how how that legal liability would be shifted onto the organization.
Anybody else? Other questions, comments, concerns? No? Then, unless you've got something else.
I don't sing very well, so. we'll
No,
call
Lord
that
knows.
not.
All right, then thank you all for coming, and I do have that sheet up here that does show your new assessment rate. If you want to take a look at that, just so you've got a rough idea of what you're looking at budgetary numbers wise. Thank you all. Have a good evening.
There's water and cookies and stuff over there. Please take some.